So what does holistic health look like for women, especially when it comes to women facing infertility?
Well, I'll tell you just from my personal experience, it's so interesting. I think that there are so many, we're faced with an onslaught of, like you said, different potential toxins, a different environment, a much more fast-paced life that's going to affect us mentally, and social media, which has its own layers, as well as I've found a lot of hormone imbalances. And so the amount of women who are dealing with, for example, something called hypothalamic insufficiency, which is a fancy way of saying that the gonadotropins, which are hormones that come from our brain and talk to our ovaries and eventually cause ovulation to occur. They cause the release of the hormones estrogen and progesterone, which help support our bodies and also help support a pregnancy, for example. With hypothalamic insufficiency, those hormones, because of stress in some ways, be it emotional or physical or nutritional stressors, they might become lower, that they might not be released as readily. And as a result, you may not ovulate as quickly as you normally would. You may not produce as much progesterone to support a pregnancy as you normally would. And there are all these other hosts of effects. Again, for example, I feel like in my practice, a large number of patients have begun presenting with these issues. And I think that it's partly some of the stressors from 2020 and then 2021 and 2022 and all of this. Yeah. So that's one example, or the incidence of thyroid issues that I'm seeing, some of these other hormones. The nice thing is that, again, this can be mitigated and addressed by both a root cause approach. For example, what are these stressors for you? How can we build a plan to help recenter yourself in daily life, as well as different botanicals? And so you can really use both to try to heal this woman. And the same goes for something like polycystic ovary syndrome, which is an imbalance of male and female hormones. And so it's exciting working with women and seeing them improve. It's just wonderful. And not having to rely upon, again, birth control pills, for example, to try to just mask their symptoms.
So the difference in your previous practice, when a client would come in, a patient would come in and they had, like, let's say, a hormone imbalance, and so they were having trouble becoming pregnant, as an example, or that repeat miscarriages. Would you do that same analysis in your previous practice to understand those imbalances, and would there be an attempt to treat them, or would there be, how are the treatment plans different in what you're doing today versus what you might have done in the past?
I mean, I think that a lot of them share, in terms of evaluation, a lot of it is similar. We're going to look at all of the reproductive hormones because those are areas that we can try to normalize and correct, okay? With that being said, I think I'm more complete and thorough now, and even within evaluation. And that's because, again, of this integrative medicine model that we are whole people. We're not just ovaries in a vacuum, is kind of how I think about sometimes the way I used to treat people. And as a result, for example, with recurrent miscarriage, their microbiome matters. That's the good guy bacteria that protect us against the bad guys. And we have specific defense systems and these bacteria in all different parts of our body. And so I think everyone hears about the gut and how central it is, and importance for even immunity and mood and all of these other factors. The reproductive microbiome that exists, and there are studies correlating a normal complement of good guy bacteria with, again, association with optimized pregnancy outcomes. And so I'll focus on those parts of it as well, in addition to maybe the baseline hormone testing that I was doing more before, or kind of deepening that hormone testing. So that's the evaluation part. For the treatment part, certainly, unfortunately, I think so much in OBGYN, the answer, at least previously in my practice, was birth control pills. So pain with periods, acne, abnormal cycles, heavy bleeding. It was the same answer. And it's interesting because a woman's natural cycle is this beautiful cyclicity. And they're interesting studies because those hormones, estrogen and progesterone, they go into our brain. There are receptors for them in our brain, which accounts for all the mood issues that might occur, right? Certainly even within our own cycle, let alone with synthetic hormones, right? And instead of kind of nurturing and trying to normalize that beautiful cyclicity, birth control pills, what they do is they create a flat line. It's just an unceasing amount of low, essentially low estrogen and a low amount of progesterone that then is removed for a week, a month. And so you're fundamentally altering what we should be experiencing. And so it's no surprise there are side effects from this.
What are the side effects?
So there can be, the one I see, quite frankly, the most is mood issues. But there can be side effects like any hormone may increase the risk of blood clots in the blood vessels, fortunately, and especially birth control pills. And the reason for that is it's ethinyl estradiol, which is a much more potent synthetic form of estrogen. And so as we take that and it gets metabolized through our liver, it can increase the production of clotting factors. And then that's the mechanism by which you can have an increase in risk. For example, there is a study that just came out quite recently showing that all forms of contraception, be it both combined with estrogen and progesterone or progesterone only, which many more women are using now, will slightly increase the risk of breast cancer. And so that was just published recently. There might be an increased risk. Again, the mood issue, there was a huge Denmark cohort study looking at almost 1 million women and showing that, unfortunately, from an age group of 15 up to, I believe, 30s, there is a statistically significant increase in the incidence of depression, which is double that in teens because their brains are so plastic. There's a lot of plasticity and neuronal connections developing, and this risk persists even after you stop it. And the same goes with suicidality. And when you think about this with the other pandemic that we're having right now, which is this teenage, really a mental health crisis for, I think, all ages. And in particular, we worry about it for the teens. I think it's quite concerning that so many of our girls are on contraceptives. I think they quoted that out of the 12 million teenage girls in the US, half of them are sexually active, and another half of them are on birth control pills. And so that's an order of millions that might be affected. It's crazy.
Especially with that latest study that came out about 1/3 of teen girls. I don't know if it's as of 2021 or it's a recent year that they're getting the data from, but 1/3 of teen girls had suicidality, had suicidal thoughts. 1/3.
Yeah, so.
And you think about, okay, birth control and all of that impact on them. And then social media, I think, is another factor, and just the addictive nature and it's proven to make your mood poor, increase your mental suffering. So that combination, I mean, you put them on birth control and you stick them in front of Instagram and TikTok for hours a day. I mean, that makes for a very sick teenage population.
Absolutely.
So what would be the solution for a teen girl? Do you see teen girls at your practice, and what's the solution for them?